All right, field trip's over. If you vomit, come back. If you're dizzy, come back. No alcohol. And no sports. And you, Ethan, you think you can help him stick to that? Ethan, you with me, buddy? Ethan. Ethan?
Ethan, you okay?
What'd he take, Brett?
Ow!
I need help over here! He doesn't have a pulse. We have to get him to trauma. 3, 1, 2, 3. What did he take, Brett?
I don't know, I swear.
We have a cardiac arrest! Claire, call out water. Get everyone to trauma.
We need Atwater, we need LeBlanc.
We did a talk stream, but only on the injured one. Let's get a line going. Sheppy, can you let me know when you gotta read? Pulse check.
He's in V-fib, we need to defibrillate.
V-fib, 200 joules. Brett, what did he take?
Charging, pads on. Ready.
Everyone clear? Resume compressions. Brett, what did he take?
It wasn't dangerous.
1 amp epi.
Whatever it was, he did it to impress you, all right? So if you don't tell us now, Ethan's gonna die.
Soy sauce. He drank soy sauce. You make all the new pledges do it. If they don't, they get the lacrosse stick. Most people just drink a few sips and take a whack, but Ethan drank the whole bottle.
Hypernatremia.
Made worse by alcohol consumption. The sodium's pulling water from his organs and his brain.
You can fix him, all right?
Start an infusion of D5W.
I'll take up compressions.
Bash.
Rhythm?
Asystole.
Does anyone have any other suggestions on how to save this patient?
Time, Dr. Curtis.
Time of death, 4:17 a.m.
What?
We can't save them if they don't tell us what's wrong.
Plaques are perfect. Interrupt neuronal communication.
MS?
No, MS is complicated. I think this is more basic. It's just tachycardia and seizures. How much longer the burn unit guy's gonna keep him in that thing?
Lecture's over. Let's go. Haz wants to... Adam's waking up.
Get the anesthesiologist in here now.
He's in pain.
That's no pain.
Need some help in here.
Adam had an orgasm.
What? You mean while he was...
What's wrong?
I'm having a migraine.
Are you okay?
Yes. I was right. Oh!
I'm not knock you out for a couple of hours.
Oh, I got work to do. Just give me sumatriptan for the pain and verapamil so it doesn't recur. I heard the patient had fun in the hyperbaric chamber.
Yeah.
Gotta schedule me some time in there.
Weber's meds aren't even legal in the U.S.
It's legal in India. I was disoriented.
Moving around is a bad idea. Hey, if you feel chest pain, you need to let me know. Verapamil can cause congestive heart failure.
Nothing can hurt my heart.
Hey, you're gonna feel some dizziness. Definitely gonna be constipated.
Differential diagnosis for getting off.
Is he gonna be okay?
No, something's seriously wrong with him.
Differential diagnosis for ejaculation. Don't make me say it again.
We're not stalling. We just don't know.
Then guess.
Could pain medication cause an orgasm?
I wish.
Maybe pain caused the orgasm. You get a tattoo, the brain releases endorphins, which create pleasure.
Most people don't orgasm from a needle prick.
Well, Chase has a point. The brain is like a huge train station. If the switches get... You're the neurologist. Talk for me.
If sensory information got misinterpreted by the medial forebrain bundle, it's possible for bad to feel good and good to feel bad.
He's a lucky kid. Let's not fix him until the burns heal.
So what attacks the medial forebrain bundle?
Infective neuropathies, vasculitic neuropathies.
Krabs disease, metachromatic leukodystrophy.
All very bad things. No way to look for any of them in his condition.
Could be an infection.
I said infection about 8 seconds ago.
You listed some brain infections. But what if it's just a regular old infection festering in the burned skin?
Pus on his arm isn't causing problems in the forebrain.
He's on 20 different medications to manage his pain in his heart, how often he urinates. His brain is like a waiter that's got too many...
Hey, I do the metaphors.
The brain is stressed. An infection elsewhere could push over the edge.
So we just wait for his burns to heal to see if you're right? If you're wrong, he doesn't have that kind of time.
Dominic Larry.
He another dead doctor?
He's Napoleon's surgeon-in-chief. Cleaned a lot of battle wounds.
By amputating legs.
And with bugs.
Maggots are implanted directly into Adam's burns.
Maggots, they eat dead people.
Maggots eat dead flesh, only dead flesh. So they're perfectly suited to clean wounds. They also kill the bacteria that thrive in injured tissues.
I'm fine. It's just a really bad cold. It's our first vacation together. Emergency room's not on the itinerary.
Temps 100.4.
Stan, it's barely a fever.
God forbid he let on that he's sick.
I've got a stubborn one also.
Me too.
Lymph nodes are enlarged. All right. I'm gonna have you open your mouth for me.
He hasn't eaten in 3 days. Can barely sip water. Hurts that bad.
Throat is pretty raw. Tonsils are swollen. Yellow exudate.
What's that?
Pus. Maybe an infection.
See, we should have come yesterday. I'll get a rapid strep test.
Let's get a CBC and BMP also.
I'm sorry. I just wanted the trip to be perfect.
And I just want you to be healthy.
Well, hopefully we can solve both of your problems. I'll be back shortly. Hi, guys. So Tommy, you do not have strep, but your body is most likely fighting off a bacterial infection. So I'm going to start you on clindamycin, which is an oral antibiotic.
Whatever the bug, it'll take care of him.
So we can get out of here.
Yes, but please just try to take it easy the next few days. As cliche as it is, rest is the best medicine.
I won't let him leave the hotel, promise.
Ow!
Are you okay?
My ankle.
Why don't you let me take a look?
Whoa, that's really red. You didn't feel anything?
Hot and fluctuant.
Iron dear.
Yeah. Now, I'm gonna make a small incision so that we can get a sample, okay? All right, and when I ask you to, I'm gonna have you take a deep breath and exhale for me, okay? All right, this is gonna hurt a little bit, all right? Take a deep breath in. Good. And another one. And again. Good. One last time. Great job. All right, here comes the incision.
Oh. Is that what was in my throat?
How did it get at his ankle?
Let's just wait and see what the lab says. Bad news, though. You guys are gonna have to hang out here a little bit longer. I'm sorry. All right. If you need anything, I'll be close by.
Bacteria can travel once it enters the bloodstream, but for a new infection to manifest that fast.
Yeah, something's definitely going on. Stay in the lab, okay?
Yeah.
Hannah. Hannah.
Oh my God. Tommy? Help! Help! What's happening?
Temps up to 104. He's tacky. BP's 94/62. Septic shock.
First dose of egg didn't work. Bolus a liter of normal saline and push IV Tylenol. Tommy, can you open your mouth for me?
What are you looking for?
Abscesses that weren't there earlier. Nothing dental, oral. Help me search his skin.
Nothing on this side.
Here, Arthur. Get a cooling blanket. He should be getting better, but he's only getting worse.
It's gonna be okay. It's okay. Deja vu. Oh, I had pneumonia right after college. Spent 2 weeks in the hospital, Waukesha, Wisconsin.
Let me guess. Same vending machines?
It's amazing.
Cafeteria makes a great smoothie.
No, I want to stay close to Tommy. I'll find something.
Hey.
Hey, Tommy's latest labs. He doesn't have a staph infection. Vancomycin-resistant enterococcus.
A superbug?
Yeah, and one that is not easy to get. VRE is a nosocomial infection. It lives in hospitals. I don't think I've ever seen it contracted anywhere else.
Hannah. She had pneumonia a decade ago, was hospitalized for 2 weeks, could have picked it up then, had it ever since. Asymptomatic carrier.
Intimate relationship. Lots of ways she could have passed it on. Okay, let's start Tommy on IV linezolid, swab Hannah's nose and throat for the bacteria, confirm she's the source.
Got it.
I got this from Hannah?
How? I don't have a sore throat, no fever, aches, pains. I'm not sick.
You don't have an active infection, but since your pneumonia, you've been contagious.
For 10 years? I work in an office, cross paths with dozens of people every day, not to mention boyfriends before Tommy. No one else has ever gotten sick.
We're gonna run some tests and find out exactly what it is.
Honey, I'm so sorry.
It's not your fault. You had no idea. Besides, I'm feeling better. It means that these antibiotics are working, right?
Yes.
Put Anna on them. Kill whatever bug she's been dragging around the last 10 years.
I'm afraid it's not that simple. You see, as a carrier, you're colonized with the bacteria, which means it lives in too many places in your body for the antibiotic to be effective.
You mean I've got this forever?
I'm afraid so.
Then I could give it to Tommy again.
With precautions, the risk of reinfection can't be reduced.
Oh, this can't be happening.
We can deal with it. We'll figure it out.
The hormones stimulate your thyroid. Don't worry if you get flushed or you start to sweat. It means the thyroid's working. And if you want, I can remove that mole. I'm a plastic surgeon. You're allowed a little vanity.
I'm fine with the way I look.
Good for you. Although I do find it a bit odd that someone so self-assured doesn't want her doctors to find out what's wrong with her.
What are you talking about? Why else am I here?
You're jerking us around. You're handcuffing us with all these restrictions.
Feeling warm.
Her pulse is 120. Stop pushing. If House thought this would handicap us, he wouldn't have taken the case.
Or maybe that's why he took the case. He wants to see if we can get it out of her on our own.
What did you find at her home?
You were in my home?
Nothing.
Travel pictures, yearbook, her name on an employment slip.
We weren't checking for that stuff, okay? Obviously, Haas didn't want us to.
You're gonna out me, aren't you? You're gonna ruin everything.
Nobody's trying to do anything. Just relax.
This is not a normal response. The test pulse and BP are too high.
Get away from me. Get away from me. Don't touch me.
Paging me during Judge Judy, not the best way to win my affections.
She had another episode of synesthesia. It set off a psychotic attack, and now she ran in there and must have jammed something in the handles.
So you call me, the guy with one good leg and zero leverage.
We break that door down, security shows up, and her name goes in the file.
Luckily, violence is not the last resort. Extortion is. So go ahead, extort her.
If you don't open this door, we're gonna break it down.
Clever. An appeal to her deep concern for hospital property. Let's see how that works.
If you don't open this door, you're going to die.
Go away.
You seem to be getting to her.
She doesn't care if she dies.
Think she wants to die?
No, but I think she only wants to live under certain circumstances. Open up, or I blab your secret to everyone.
You don't know anything.
I do.
No!
Anybody think that a sedative might...
I'm trying.
Okay.
Who's that? Who is she?
Osama bin Laden.
Why'd you have to pick tequila? I assume a single malt would have worked just as well.
Wasn't our choice.
Okay. 2 minutes, then round number 5. So tell me about the magic underwear.
Is that why you're here?
I'm the big drinker, doing my part for science. The interesting question is why your religious beliefs are suddenly less important than her dreams.
You're reversing your argument?
I know what I believe. Just not quite sure what you believe.
Well, LDS doesn't try to dictate every detail of our lives. When a situation isn't clear, we're encouraged to make our own decisions.
But your judgment was to say no. You used my judgment.
You made a good argument.
Rational arguments don't usually work on religious people. Otherwise, there would be no religious people.
You're an atheist.
Only on Christmas and Easter. The rest of the time, doesn't really matter.
Where's the fun in that? A finite, unmysterious universe.
It's not about fun. It's about the truth.
The truth is, we're having this debate because you want to figure something out about me. What do you got so far?
Greta.
She can't breathe. We need to intubate.
No.
At least oxygen.
NASA, we'll need to know why.
She was having trouble breathing, refused oxygen and intubation.
So you put her on a treadmill.
Records will show that we gave her oxygen as a part of a routine cardio stress test. If she gets to breathe, your boss gets her paperwork.
Whose idea was that?
It's a joint decision.
It never is. So how old were you when your brother left home?
Why do you think that
Why aren't you answering? Did your mother initiate the divorce?
We should probably focus on what's wrong with her lungs.
Are you a Wiccan?
She really can't breathe.
Okay, hold still.
What are you doing?
Auscultatory percussion. If you have a good ear, you can... You didn't have a lot of friends because you
You
chose
can hear while you're talking?
You can detect not only structural details, but small, deep masses. Game's over. You either had lung cancer or tuberous sclerosis. need to cut you open and biopsy.
That'll leave a scar. As the doctors will see, they'll know.
I never opened for Springsteen or slept with Barbara Feldon. You can live for years without dreams, without lungs.
I'll find a way.
Okay? As long as you keep saying it strongly, you won't die.
Fine. Away.
Get a resuscitation team.
Just keep your eye out.
Respiration shallow and weak.
Give me a CBC, BMP, Chem 7, and a saline lock. Anybody know who this is?
Found a boarding pass in his pocket.
Stop. Everyone, back away from the patient. Masks on, now.
BSF protocol in effect. Check. Nothing left here.
This is Max.
We have a patient in the ED from Liberia presenting with all the signs of malaria, Lassa fever, TB, or
Ebola.
The first thing we do is call the mayor's office and the CDC if we even suspect Ebola virus. Now, the patient is in an isolation chamber with negative pressure airflow. That chamber is equipped with every available medicine should the patient need to self-medicate.
What about us?
Ebola isn't airborne, but if you develop symptoms, you will join him. Until then, you will help him. Everyone interacting with the patient is required to wear personal protective equipment at all times, no shortcuts, ever. Good. Once blood is drawn, the test results will come back in 24 to 48 hours.
commencing a code green blood draw at 1:10 p.m. New Amsterdam Hospital.
Dr. Goodwin?
How can I help?
Dr. Kapoor's patient in 1208. He wanted to be kept in the loop.
Yes, thank you. How's she doing?
I think Dr. Kapoor is going to kill her.
Max, this is Detective Rose from NYPD and Agent Bratton from the FBI.
The CDC alerted us to your patient with Ebola.
We're still waiting on the test results. I'll be with you in 5 minutes.
The NSA just intercepted a video made by ISIS. They claim they sent one of their followers from Liberia to New York City, infected with the Ebola virus. Your patient is now a terror suspect.
A man came to my village.
What was his name?
Ayan.
Last name?
I don't know. He was showing off money he made in America from selling kufi hats and dashikis in Times Square. He offered to give me clothes to sell and a plane ticket if I give him half of what I make.
And you believed him?
Yes. He took me to doctor for a traveler's vaccination.
Alan, where did Ayan want you to go when you got to America?
Youth hostel in Times Square.
Then why did you come here?
This is the only hospital in America I heard of.
He's not a terrorist.
We'll gather the evidence.
If he was a terrorist, he would have gone to Times Square where he could have infected the entire city, but he didn't. He came here to get better. He was clearly tricked into getting something injected into his bloodstream. You see that, right?
Dr. Goodwin.
Just please promise me you will look into his story.
I'll look into it.
Synopsis, he's crashing! Hey, can someone help me in my suit? Alon? Alon, you need to grab the oxygen mask. Alon? Alon, it is right above you. Helmet now! Forget it. I'm going in.
Dr. Bloom, wait!
Bloom! Get out of there now!
It's too late! I'm already in! There's too much blood! I can't see anything!
Heart rate is dropping. He needs adrenaline.
I can't stop bagging.
Adrenaline first, oxygen after. Okay, go. Okay, now push 10 mLs, open wide.
That's too much.
Not for this kind of virus.
It will send his heart rate too high.
Push 10 hard and fast, right now. Lauren?
I know what you're gonna say. That was stupid. I violated protocol.
Lauren. Your glove.
Doctor.
Keep your hands off me.
Hey, we're trying to help. We just want to take a look, okay?
What do we have here?
Dr. Choi, this is Ray Ochoa, who insists that there is nothing at all wrong with him.
That's weird. Charge nurse said he was found doubled over on the floor of a gas station bathroom, screaming out in pain.
What's the screaming in pain? Only gay-ass punks do that.
Ray, you might not be aware, but I'm a Navy flight surgeon still in active reserve. And Jeff here was an Army Ranger. Seen plenty of men screaming out in pain.
Tougher guys than me.
So, how about we take a look?
How about you suck me?
Ray.
Come on. Seen this movie before. Even when he says he has something lodged up his rectum.
Seriously?
See how he's hunched up on the gurney, trying to take the pressure off the rear end, plus all the lip. The embarrassment makes him combative.
All right. Try again, X-ray.
Thanks.
Mr. Clark, what are we looking at? Mr. Clark.
Sorry, we have a safety issue. Everybody, please step out. Step out. Okay, thank you. Step out. Laura, hey, Laura, that's you. Security, over here.
What's going on?
Dr. Choi was right. There is something lodged in the rectum.
What is that, a gun?
He says he has no idea how the gun got up there.
All right. What are our options?
It's not gonna be easy getting it out. It's just past the sphincter.
Plus, the hammer's gone. So if there's a live round in there...
Seriously?
Could do some real damage. 22 single-shot Derringer. It's a big kick for a little gun.
So we work up a plan to get him to the OR. Page the surgeon on call.
Miss Goodwin, I think it'd be safer to do it here. Jeff and I both have weapons experience. We sedate him, try to slide it out. If we can't make it, then we call in surgery.
I'm in.
Should we call CPD? Yes, we'll need enough body armor and gear to protect whoever's in there with him. And let's keep this area clear.
And I'll keep the cameraman away from all this. It's unsafe and, frankly, it's distasteful.
Thank you.
I like your tattoos. Who designed them?
Me.
You're really talented. You go to school for that?
No. Just fool around on my own.
Huh.
I saw you looking at my scars. You're not gonna ask me about them?
Do you want to tell me about them?
What, are you a shrink or something?
Not yet. Officially, I'm still training. Do you cut yourself, Ray?
I'm not crazy.
I know. What I'm discovering doing this is how we all do things that we can't explain. Things we say, things we do to ourselves. Maybe we're just experimenting, see how it feels. Or maybe we're reliving something that happened to us in the past. Did something happen to you, Ray?
Dr. Reese?
Mr. Ochoa.
The hell is this? People are saying you're some kind of freak.
It's not what it looks like, Papa. It was for Wilmer.
Your cousin? That fool's in Crook County.
He asked me to smuggle a gun in for him. Said he needed to protect himself. The guy in front of me beeped going through the metal detector.
They tackled him to the ground. I guess I panicked. Ran out before they could search me. The pain must have made me pass out. Sorry.
We're gonna get started now, Ray. If you feel any discomfort, just tell us. I need you to stop moving your leg, Ray.
Where am I?
Just keep still, bud. Almost there.
What?
Gun vacated!
Go, go, go!
You okay, Jeff? I'm all right. How's he?
Get pressure on that.
Exit wound in the right lower quadrant. We need a trauma lab. Pack the wound. Let's get him to the OR. Ready? 1, 2, 3.
All right, we're moving.
Let me take a look.
All right, watch your back. Coming through. We're gonna take this right to OR.